Welcome to the premier Avita webinar. Today, the webinar is the good, the bad, and the ugly of hysteroscopic systems. And before we get into it, I just want to first thank you all for your time and consideration for coming to this. We know that you have busy lives, and we just appreciate your interest and your willingness to spend some time to talk with us. Also, everyone's been muted, and to communicate with us, please use the chat function. And our goal at the moment will be to address any questions, comments in the chat at the end of our presentation. All right, so let's just do some quick introductions. I'll go ahead and start first, and then I'll have Dr. Zoyla Almeida and Dr. Erica Stockwell do a quick introduction as well. So I am Dr. Peter Heinlein. I'm a recently retired permanente physician from Northern California. And my relevant background for the discussion today is that within my role within the Permanente Medical Group, I was the co-chair of the OBGYN National Technology Committee. And within that committee, we would evaluate all products that OBGYNs use, including hysteroscopic systems. And throughout those evaluations, we would basically create a formulary of products that our physicians would use. So I've had the opportunity to compare and contrast and evaluate all sorts of equipment in this today, hysteroscopy, of course, as well. Dr. Almeida, will you go ahead and give us a quick intro and relevant background?
So good evening, everyone. Well, here at 7 o'clock in the evening, but my name is Zoyla Almeida. I'm a GYN oncologist in South Florida. I end up doing a lot of benign and malignant work. I'm also involved with resident teaching and medical students. I'm very excited to discuss Aveta tonight.
And then Dr. Stockwell, will you also provide us with a quick intro and a relevant background for tonight's discussion?
Yes, hello. Hi, good evening, everybody. Also coming from Florida, I'm Dr. Erica Stockwell. I am a benign GYN surgeon. I'm a fellowship trained surgeon, and my relevant background is also hysteroscopy in office and in the OR. I do currently work with residents. I'm a past assistant fellowship program director for the minimally invasive fellowship program in Las Vegas. I've been here in Florida for 5 years now. And prior to medicine, I was an engineer in biomedical engineering. So self-proclaimed techie geek, like to evaluate and try out new technology. So have lots of experience with other hysteroscopic systems as well.
Excellent. All right, and then all three of us have our consultants for Meditrina, so that's our disclosures for today. The objectives today are to compare the experiences of hysteroscopic systems, including the Avita, MyoSure, TruClear, Symphion, and resectoscopes among high-volume expert hysteroscopists. And we're basically just going to have a discussion of our experiences. We do have some slides to show some of the details of what we're talking about. In addition, let's also talk about what we mean by hysteroscopic systems. So what we're talking about today are systems that can perform all the hysteroscopic procedures. So not only just diagnostic, but also polypectomies and myomectomies, as well as lysis of adhesions. And so we'll be talking about the systems that you see up here, but also we are not going to emphasize or discuss in any details systems that are primarily diagnostic, such as Endo-C or Lina or Luminal 360. While we have this slide up, we should also talk about, just give a little bit of a history. And what the main point of the slide is to recognize that the TruClear MyoSure systems came out quite a while ago, back in the 2000s, and Minerva followed in 2013. And there really hasn't been much change in these hysteroscopic systems or any new developments until more recently in 2019, when Meditrina released the Aveta system. And one of the points to this is that there's been enough time to really consider what type of innovations and changes physicians as yourselves and myself would want to have in a better system. So we will be bringing up that. And so each of us will be talking today um, about, the experiences that we've had with the older legacy systems that exist. And then once the Avita became available, why did we decide to trial it? And then why did we decide to eventually adopt it as our primary system of use? All right. And the last thing is for you all in the audience is while we're talking through this subject today, please consider your own current hysteroscopic system. What do you like about it? Are you completely satisfied with how it performs? Are there any significant limitations? And what would you like to have improved or modified? And perhaps you really haven't thought about these type of questions before, and that's okay. That's really common. Um, we become accustomed to what we use and we accept the limitations, and sometimes we'll create runarounds to try to fix whatever is not working. So again, what we'll be talking about today is about whether or not it's worth it to consider and evaluate a new hysteroscopic system and change over. First, talk about life before Avita. And Dr. Almeida, let's start with you. Um, please describe your experience. What products did you use? What did you like about each system, if there was more than one? Let's just kind of go through what your experience was like before Avita.
So before Avita, my hospitals and the outpatient centers only had the MyoSure, and so that's what I would use. I was using it without any major problems, and you said it perfectly, the workarounds, you learn how to modify and try to reach what you're trying, the pathology that you're trying to get out. And then even before that was the old way with the resectoscope, right? If we're old enough, we remember how we would even sometimes put in the camera, remove it, and then use a forceps to remove the polyp almost blindly. And so technology has come a long way and very appreciative. And that's what I used before trying Aveta.
Okay. And do you currently still use a resectoscope in any way, fashion, or is that something that you no longer use?
I no longer use it, and I'm sure that many of the surgeons on this panel are experiencing the same thing, that hospitals are trying to not have so much instrumentation in their ORs, and they're trying to make things more simpler for the staff and not have so many different systems. And so I don't think that maybe just one of them has a resectoscope, and they
Okay.
all still do use the MyoSure, except for one place.
And with the MyoSure, were there any particular characteristics that you like about it, or thought was not this is a great innovation and this was why this was the main system that I used, or was it just what the hospital had and that's what you ended up using? Was there any thought process on how that came about to be the one that you used mostly?
So it was the one that was there. It does a good job in the sense that, it's a good system, good visibility. There are some hiccups, some things that I wish over the years of using it could improve. I think one of the things that is a little bit difficult, and this also happened mostly during COVID, when we would have different travelers, different staff, they weren't familiar, and it does have a lot of parts to put together. I find that challenging when you get someone that doesn't know your work. They're trying to put a system together that they're not that familiar with. And sometimes it was hard to get certain fibroids, septums, polyps, or even sample some of the tissue that I wanted to in certain angles. specifically at the top of the uterus or near the osteus.
Okay, great. Um, and then Dr. Stockwell, same thing for you. Life before Avita. What was your experience like?
Well, I've been lucky enough that I've been actually been able to experience a lot of different technologies throughout my training and throughout early on in my career. I went to a large residency program and we went to a lot of different hospital systems and also ASCs and clinic procedures. So depending on the hospital system I was at, we used either TruClear typically or MyoSure. And to me they're pretty similar. TruClear, able to get to fundal pathology, like Dr. Almeida mentioned, the pathology near the cornea a little bit, maybe a little bit better. And then when I came to Las Vegas, we were one of the early users of the Symphion. In fact, I had the opportunity as a fellow to write one of the white papers for the Symphion. So I grew to really like the Symphion. I liked the fact that it was an all-contained fluid management system and had the capability to use bipolar energy to be able to coagulate. And then coming here and I should mention in the office too. In the office, I use the resector, which was by Boston Scientific at that time. It was a handheld manual device. We ended up in it, lots of parts of that too, a whole suction canister, suction tubing, all of that. We switched out to using the handheld MyoSure in the office. I also use endoscopy in the office. I know today we're talking about more operative hysteroscopes, but also did polypectomies and things with endoscopy as well. And then coming here to Celebration, I've been here for about 5.5 years now. They have MyoSure in the office, and I wanted to do they MyoSure in the OR. I misspoke. I wanted to do in-office hysteroscopy. That was a big part of my practice in Las Vegas before coming here. And so we explored and looked at a couple different devices. I used, for a shorter time, I used Benesta. But found a lot of issues with using that device, so stopped using it. I was really looking for a good system that I can use in the office, as well as exploring different systems to be able to utilize in the OR. I should mention I also still use resectoscope. I learned resectoscope in residency, used it in fellowship. It's not my go-to for polyps and fibroids, but I do find certain cases where it could be very helpful for, like big, thick vascular septums, those type of things.
Among all the systems that you've used, was there any common limitations or kind of what were you coming against that would make you
Yeah,
or like was there some kind of similar limitation to it all, or was there something specifically
or other,
different about
well,
each
I
one?
think early on, a lot of the limitations were with the fluid management and visualization. Um, and I find that some of the devices, most recently prior to Avita, the MyoSure device, sometimes you have an unstable cavity. So even with the built-in fluid management, sometimes when you activate the device, you'll get this, it almost looks like spasming or contracture of the cavity. And of course, when that happens, it could disrupt your visualization, and also allow for bleeding inside the cavity. So my biggest thing is not only what Dr. Almeida mentioned with regards to just all the parts and pieces and the OR stuff. It's very painful if you, past the bewitching hour of 3 o'clock and you're with a whole new team and nobody knows how to use a setup, a hysteroscopy setup. So the efficiency for turnover, the visualization. I mean, I think
They
there's
were looking for
kind of
something for
a
all
number
that.
of things.
Okay.
Yeah.
All right, great. Um, And for me, life before Avita, I think, I would agree with everything that you guys have said. My biggest issue was really I wanted something that cut faster, and I also wanted something that would remove like the fundal or corneal pathology easier, which basically means getting something that cuts at the tip. So that was kind of my primary thing, my things that I was looking for or continue to experience limitations with. Um, so let's go on to the next question, which is what led to your desire to trial Avita? We've kind of already talked about the limitations, but let's go back with you, Dr. Almeida. And um, what, uh, was there anything in addition or by asking this question that would give you a more specific answer to it?
So one thing that attracted me to try it was when it was presented to me was the fact that you had control of a lot of the things with your hand, with the little buttons on the handle. With the flow, uh, with taking the pictures. I call it the wiper when you give it the little burst of fluid and it clears up the picture. That was very attractive. The size of it, the weight of it, and really, we already talked about the ease of putting it together, but one feature that I really liked was the camera, it being LED and not having heat to it.
How did it come to you in the first place? Do you remember how it was presented to you, or were you looking actively out for something?
No, there was a rep that came and showed it to me. He's like, "Can I show this to you?" And I said, "Okay, can you come to the office?" And lo and behold, that person brought like hot dogs and showed it how to do it right then and there. So
Okay. And do you remember how long ago was that? Was that actually like in 2019 or was it more recently?
I would say maybe 3 years ago.
Okay. And with Dr. Stockwell, same thing. Like we've already kind of talked about some of the limitations and frustrations with the systems that already existed. Was there was there one thing in particular, or what kind of led to you to search out for something else? Not necessarily Avita itself, but what was it that made you decide you were going to spend this energy to seek something new?
Yeah. Well, yeah, for me, like I mentioned, I was looking to build up an office hysteroscopic portion of my practice. So as I came here, and trying to build that in. So we were looking at different devices and I wanted the versatility. So I wanted something that was going to be familiar that I could use both in office and in the OR. What really attracted me to it for a number of different reasons, but one of the biggest things I think that is very unique to the Aveta system is the autonomy. Like Dr. Almeida mentioned, is you have control of everything right on the handpiece. You don't have to rely as much on your circulator and other people in the room. You can control your fluid management. You can set your deficit, your flow rate, your blade cutting rate, everything right there at your fingertips. So for me as a surgeon, for all of us, I think whatever gives you more autonomy gives better efficiency in the OR and also better safety, patient safety. If you can control more things in the OR, ultimately, it's going to benefit the patient and benefit you. So that's really what drew me to this device, in addition to a number of the other things I think I will continue to mention.
Great. And then for me, as I already mentioned, I was looking for something that would cut faster, and I wanted to get to that fundal pathology. As I mentioned earlier, there was this where I worked, and one of my responsibilities was as the co-chair of this technology committee. It was called a sourcing and standardization group. And with our hysteroscopic tissue extraction experience, we adopted and started way back in the 2000s using MyoSure. At that time, we found MyoSure to be an easier system to use, and it was just packaged in a way where office-based practice, it supported the office-based practice better, and we did a lot of office-based procedures. But then through the 12 plus years of using primarily the MyoSure system, um, we didn't experience a lot of innovation. And with the big contracts that we have nationally, we would frequently talk to companies and ask them to make modifications, and we just didn't get a lot. I mean, MyoSure did a great job of bringing out the Reach handpiece in about 2015. Unfortunately, what happened with that was that our surgeons started to use it for everything, which basically kind of let us know that. And that was a problem because the Reach handpiece was in the $900 range per item, where the light handpiece that's designed for polyps costs about $400 less. And when we're doing thousands and thousands of hysteroscopies, that really increases the cost of care, and we weren't too thrilled about that. But it let us know that cutting at the tip was important for our surgeons because that's what they wanted to use, even though it costed more money. And then the other innovation that MyoSure came out with was a change from their Aqualux fluid management to the Fluent. And unfortunately, that also increased a cost to us because each fluid management disposable plastic parts of it was an additional, I think, like $140 or so. So we were getting frustrated with the fact that, this is a product that's working for us, but we're having some contract issues as well. So we started looking around for something else. And the first thing we did is we brought TruClear back onto our contract so that we had MyoSure and TruClear as an option. We did that pre-pandemic to see whether there's going to be any traction. There really wasn't much. People liked the MyoSure device and weren't interested in changing. Then in 2019, our Washington, D.C. Mid-Atlantic region um, had a problem with sterile processing, and they were looking for something disposable that would take its place while they were dealing with their issues with sterile processing. And lo and behold, Avita was there. And so we got a little bit of experience. And the experience was so positive that we decided to do a national trial to assess it further. And so with that national trial, we did more than 100 procedures through with surgeons from Northern California, Southern California, and the Mid-Atlantic. And we asked them to measure their experience compared to their current device in the measurements that are listed in the first 5 bullets that you see on this slide. And in each one of these bullets, the evaluation for the Aveta system was superior, and really superior. It was really just overwhelmingly positive. So ease of setup, cleanup, and faster turnover time was an obvious bonus. Fluid management qualities and maintaining distension also was superior. Image quality and diagnostic qualities was superior. Morcellation effectiveness of both polyps and fibroids. That was my big thing. How fast is it going to be able to remove the tissue? Definitely better. It was ergonomically better. It was lighter. It fit the female and male hands very well. And then additional things that we learned was that you could do the same procedure with polyps and fibroids with less dilation. Our managers and directors were in love with the fact that there was no sterile processing because of all the hassles with missing pieces and broken scopes. And then we'll show later that even though it's a disposable system, there was actually less waste. Um, and then we thought it was an estimated cost neutral system. And that's what we basically have experienced since then. So now that we've done that today, we've already kind of talked about we talked a little bit already, but let's kind of go into a little more detail what life is like today with Avita. So let's go back to Dr. Almeida. And can you describe how your hysteroscopic life has improved now that you use the Avita system?
Yeah, so to me, it just flows very well. I think we've addressed a lot about the ease of the setup. I teach residents. It's nice to be able to teach them exactly what Dr. Stockwell was saying about the autonomy, about teaching them about increasing, decreasing the pressure, where to take the pictures. I'll quiz them. I'm like, what's your fluid deficit, right? And then they have it right there in front of them. The ease of taking pictures, not having to ask someone to do it or move your hand. It's a very steady kind of instrumentation. It's also very efficient in removing whatever needs to be removed in the cases, whether it's a polyp, fibroid, a septum. And one of the features that I personally like, and I try to demonstrate it to the residents, is the feature of removing the tissue versus the biopsy. little square on the other side, and I'm sure we'll show that and talk about that as well. So an additional thing that we didn't mention is one of my favorite things is the camera itself. You can use your fingers to turn the knob and to change your angle as opposed to moving your hand like this. So that's been very, very good for me personally.
Fantastic. And so just to emphasize some of that, I have just a few slides. Some of these are really busy, but the point here is just to realize that the Avita system, this is it. This is the whole thing. You got your monitor, your fluid management, your hysteroscopes, and your tissue extraction devices all here. There's no light cord, there's no light box, there's no camera head, there's no camera processing box. It's just extremely simple and innovative in that sense. Um, this is just a comparison with TruClear. It's the same idea, just less parts. This is an up close picture of the hysteroscope with one of the shavers coming through. The light source is at the tip, the camera head's at the tip, and then um, the tissue extraction device comes through here. What you can't see is on the other side, there's a flat opening that is really good for doing little biopsies, but it doesn't actually dig into anything. So it's a super cool little feature to it. Here's the automation that we were talking about. The view is here. You can here's the intrauterine pressure, and you can adjust that on the scope. Here's it shows you what the deficit is, and you can actually kind of watch it in real time. Your irrigation flow can be adjusted to different settings, and your cutting speed can be adjusted as well. And in my own personal experience, what I love about this is that I can basically watch how fast am I removing that fibroid and how fast is the fluid deficit increasing. And it provides me with a really good understanding of whether I'm going to get this thing out in time or am I going to hit that fluid maximum soon, which then allows me to decide whether I need to lower the flow of fluid, decrease the pressure to decrease fluid absorption. Do I need to enhance everything with maybe a little pitressin? It's just a really interesting innovation that I didn't realize I needed, but now that it's here, I couldn't do without it. Um, and then the last thing is here is a picture of the hysteroscope itself, that changing the angle of your scope. You can do that here by this little knob. You basically just twist it and it just moves the camera around at the tip. Um, and then all the controls are on your hand here. You don't have to do all these. You can have an assistant do it for you, but once you start using it, you realize you just want it all in your own hands. Let's come back to you, Dr. Stockwell. And how about sharing a little bit more about life today with Avita in your life?
Yeah, well, I've gone all in. It's in my office, in the OR, any hysteroscopic case I book, except for the few cases mentioned with the resectoscope still, but for the majority of my cases I use Avita. In the office, I use it with just a hanging bag, with a pressure cuff if needed. I practice a lot of no-touch hysteroscopy, so going from vaginoscopy to hysteroscopy without needing a speculum or tenaculum. The slight angle of the camera allows introduction into the cervix and into the uterus very well. By being able to control your pressure settings, you can increase your pressure as you're hydrodilating through the cervix, and then decrease it or drop it right away as soon as you get into the cavity. So yeah, I'm able to do that very quickly and easily with the touch of a button with my hand. It's been great. I think that the rotation that you guys have mentioned and showed on the previous slide is also very unique and different with regards to this device versus some of the other devices. It's nice not having to swing the whole light cord around, but I think the other really unique part of it is they're in the software, they have a built-in electronic image lock. So when you're rotating your camera, your view, it doesn't, you don't have to go like this with your head. Your view stays straight up and down, but you get a little bit of a different angle with your camera. So I always teach my residents as well. Now you want your camera on the opposite side of whatever you are resecting. You're able to do it very quickly and easily, not only with that dial on the hysteroscope, but actually the resection device as well. You can twist so that you can decide what blade that you're going to use.
Mm-hmm.
And that's something I didn't use initially because I was so used to some of the other resection devices that I just used the resection blade. But that biopsy window, I really have learned to love that, especially for in office when you want to get a good global curettage. So if I'm doing a myomectomy but want to get a good global curettage, I'll use the resection window on the fibroid. And then I'll turn it to the biopsy window and get a good global biopsy without digging into the myometrium. So I've really learned to like that as well.
All right. Would you like to share your video?
Sure, I have a video. It's actually my partner's video, Dr. Zlane. I'm gonna share it here. So here's a video in real time showing a myomectomy. So what I do, I use a needle that comes down the port of the hysteroscope, and I inject a dilute vasopressin initially in order to reduce blood loss and in order to reduce your fluid deficit, because the biggest thing with the myomectomies, especially if you have a very vascular myomectomy, is the fluid absorption. So you can see here we get a very good blanching at the start of the case. And now we can switch out. And again, this is kind of real time here, so you're seeing blood movement, but now we could switch out for the resection blade that's coming in. I just want to point out a couple other things here. You can see the pressure. What I have found anecdotally is I'm able to have less pressure than I have
Mhm.
historically with some of the other hysteroscopes and resection devices. So as long as I can see and get distension, get visualization, sometimes I'll really kind of drop this pressure down, especially if I'm resecting a larger specimen. I'm going fast for a little bit here. Just so that I can make sure that my fluid deficit does not go up too high. You can set your fluid deficit amount here. The max, of course, is 2.5 liters that it'll allow you to go up to. Once you hit that, the system shuts down. It will not let you go beyond that for safety reasons. And you can see here, we're using the resection window. You can see the biopsy window on the other side here. And it's very fast. I mean, it's very, very fast. You use it very similar to a lot of the other resection devices with regards to moving it around and shaving down your pathology. And we can use the aspiration window here. It could take pictures and control your settings. So I'll just kind of fast forward a little, well, let it play a little bit here so you guys could see just what it looks like when you are resecting the fibroid.
This isn't real time, so this is not some dolled up video. And it's
Mhm.
ripping apart a fibroid in a pretty significantly quick way, which is impressive. But something that I think we all recognize and appreciate once you start using it. And we'll show a slide later that looks at a bench study looking at tissue extraction rates.
Yeah. But I think you guys get the gist. I think I can stop showing my video here, but you can see this whole cavity filling fibroid. And this is what, 7.5 minutes, like I mentioned. This is my partner, Dr. Zwane, but able to remove the entire thing in a very quick and efficient manner.
Great. All right. I'm going to just go ahead and share again here, and we'll show just a couple more slides to emphasize some of the innovations we were talking about. So this is about this slide is really just about showing the difference in dilation. So basically everything that you could do with an omniscope and hologic at 6 millimeters, you can do by just dilating to 5 millimeters or less, as Dr. Stockwell talks about with no-touch hysteroscopy. So almost all the procedures you would perform with the Avita would be this. There is a larger scope with a much bigger shaver, but not really used a lot. This is just the same thing with TruClear. Here's an image of all the different shavers, and they're all cutting at the tip, which really allows you to get to that fundal tissue, I think, a lot easier. And actually, in my own personal experience, allows you to kind of deal with the type 2 fibroids a little more successfully as well. Same comparison to TruClear. All right, so here is a study on calcified tissue comparative bench study. So this is a bench study. All three of us have actually participated in this study. And basically what it's a calcified fibroid model. And when you compare the the performance, what we recognize here is that the Avita, and this is not even the most aggressive tissue extractor they have, but it performs about 2.8 times faster than the MyoSure Reach. It also has the MyoSure XL here as well, and it's much less. And then with TruClear, it's about 1.5 times faster. So also really interesting is that of the 91 physicians in this study, 68 of them were first-time physicians. So they had no experience with this. They came in and did this, and they actually still led to this overall performance of faster tissue removal. Over here is just a visual picture of the tissue left over after a 5-minute resection. And what you see is that the Avita tissue left over is a lot smaller, and it kind of matches up with what you're kind of seeing in the graph here. We talked about the efficiency of setup and cleanup. And this is a survey of 9 outpatient surgery centers and hospitals in the US that have used the system. And basically, based on the nurse's report of the survey, the experience is that there's at least a 9-minute savings of time out of the room to time back into the room, which leads to cost savings in an operating room. And then lastly, I think it's lastly, even though it's a disposable system, it's actually less wasteful than the current systems that are on the market, the other current systems that are on the market. There's about a 40% average disposable waste reduction using the Avita system in weight of waste. So that's also an interesting innovation. So we can get to some questions. And all I want to do is just offer a little bit of a summary. And basically, to summarize, I would say that each of us have found that the Avita hysteroscopic system to be worth the effort to at least evaluate it and then convert due to the significant improvements in performance and convenience. Our experience is that the vast majority of physicians will want to convert to the Avita system once they have experienced it. And what I didn't describe earlier is within the healthcare system that I was working in, once we had done that Avita evaluation, we brought the Avita product onto our national contract, but we didn't get rid of MyoSure. And then we went out to our physicians and notified them that there was this other product that was available and just asked them, give it a try, see what you think. And in more than 90 plus percent of the time, once the physician or the physician groups experience a product, they actually convert it and adopt it. So it's a pretty powerful experience that we've found. All right, I think that's the end of our planned discussion.
I can see the Q&A. There was just a question about who to contact, and if you are interested in trialing the device, I think put your interest in the Q&A, and Meditrina will get someone in contact with you with the local rep.
Okay. Um, so we do have a little nudge. We wanted Dr. Stockwell, you had mentioned earlier about um, coagulation energy.
Hmm.
Um, can you tell us a little more about, is that an important feature for you to have? Um, when you did use the Symphion product, how often did you find that to be um, a useful part of the device? What are your opinions on all that?
Hmm. Yeah, I think, in exploring the different devices and early on in using Symphion, it was something I was definitely very interested in. Again, because it set it apart from the market at that point. It was a very unique offering to be able to have some coagulation ability. In practice, I guess I didn't use it as much as I thought I would because I have other ways, like I showed with the vasopressin, to try to minimize blood loss. I mean, it certainly could be helpful if you have a bleeding vessel that is obscuring your visualization and you are maxed out on your intracavitary pressure. So, there are definitely instances where it could be helpful. I think that with regards to RF energy, and looking at the different devices that are out there and the resectoscope, I think it's interesting to note as well that Meditrina is actually creating and coming up with an RF component to their device that will be available shortly, that is kind of more similar to a resectoscope. So a loop at the end of the device to be able to utilize a RF energy. And I've been able to use that in the lab setting. It works very well. So I'm very excited about the next developments for Meditrina and where they're going with it. But yeah, I do think that there's instances that it could be very helpful for a large vascular pathology.
Okay, great. All right, I did find the Q&A part, so I was able to open it up. Um, Stephen McCarris says, can you speak to the complications related to perforation and or infection? Also, does hydrodilation work? Um, the first part of the question I can answer myself. So if you're asking Stephen, is there like an increase or decrease in chance of perforation or infection with the Avita system? The answer is no. It's just like all the other hysteroscopic systems out there. There isn't anything in particular that shows that it's within the range that you would expect. And I'm pulling that primarily from the CE mark assessment and plan that I actually had to review for the company and saw all the data. And then Jane Starr writes, not a question, but an observation. The angled tip is wonderful. The cervix is not a straight organ, and I have had fewer perforations in stenotic cervixes with the Avita. Have used this 100% since August of 2024. TruClear for 10 years prior to this. Oh, that's very interesting. So, and I actually kind of learned something myself. I never really thought about, I realized that I was more successful getting through a cervix with the Avita product, but I didn't really appreciate the fact that it had to do with the tip until Dr. Stockwell had mentioned that. And now here is another confirmation of that. Thank you for your comment, Jane.
Yeah, I think Dr. McCarris also had asked about the hydrodilation. I
Oh,
think
yes.
hydrodilation works very well. I think yeah, for me personally, I don't go straight to cervical dilation before putting the hysteroscope in. If I can get the scope into the little divot of the external cervical os, I go straight to hydrodilation. I like to be able to see as I dilate and when I have a stenotic cervix and I can see that little bit of an opening and know where I'm heading. I think that for me, I see less false passage, less false track, less perforation with that. So I think it works very well with this device specifically because you can alter your pressure and do it so quickly. So like I said, I turn my pressure way up if I'm dilating through a cervix, and as soon as I'm into the cavity, I turn it way down very quickly with my thumb.
Mhm.
I think that's like a really important point to have control of the pressure, especially when we were limited with fluids. Do you guys remember when there was fluid restrictions in the hospitals? And so that we could still continue to do the hysteroscopies with the Aveta because we would use just the 1 liter bags.
Yeah.
Stephen McCarris just just says I agree with Erica. I love the Avita system and use it 100%. Hydrodilation is wonderful. Great. Well, again, I appreciate everyone who came on to this webinar tonight. Again, your time is extremely valuable, and we greatly appreciate your willingness to sit and listen to our experiences, and hopefully, we're making a difference for you.
Have a good night.